Thank you for joining us today. I'm joined by my friend and colleague Adi from Zoom, and we'll be looking at how we're partnering together, Zoom and HP, to address the challenges that are facing healthcare organizations today. Adi, most people know about Zoom, but I don't think they really understand Zoom and healthcare, so can you offer a little perspective on that?
Yeah, thanks, Scott. It's a pleasure to be here at Infocom. Many of you know Zoom, and many of you know Zoom for meetings, and some of you maybe even know Zoom about telemedicine. However, we're a little bit more than that. When it comes to healthcare, Zoom focuses on three main areas. Starting with patient management or patient engagement, where we currently have a market-leading 36% of the telehealth market, according to Definitive Health. We also deal with healthcare collaboration when it comes to administration, staff. We're talking about meetings, phone, chat, just to improve efficiency and productivity. And lastly, we're involved with healthcare operations, enhancing overall healthcare experience, tools such as contact center, frontline worker, solutions, and more. So, Scott, what's going on in healthcare at the HP side?
Most of you know HP for our computing and our print and print services businesses, and you probably know our Poly brand for our history in audio and video collaboration. But you may not know that we have a large presence in healthcare. So we're going to talk a little bit about inpatient collaboration later, so we'll go more into that. But we have a big presence in hospitals, not just in the back office, but in point of care computing. We have a whole line of products called the Engage line that's used in the patient room and clinical workstations on wheels, for example, for kiosks, for check-in and hospital lobbies and that. And like our friends at Zoom, we're strong in telehealth solutions. We've been putting together hardware solutions for telehealth for over 20 years.
So thanks, Scott. I think we all know healthcare is facing a lot of challenges. What are you seeing out there from challenges perspective?
Well, our healthcare customers are facing a lot of challenges, and if I had to summarize them into maybe categories, I would say clinical is one category, patient experiences is the second, technology issues, notice I said not technical issues, but technology issues, and workforce issues. So if I start with the clinical part, there are a number of different clinical issues that hospitals are facing. The number one we hear about the most is patient falls, because that's such a huge issue, because there's over 1 million falls a year, 35,000 of those are significant events, but there's other clinical issues that happen, like extended length of stay in the hospital, 30-day readmissions for the same condition. But falls, as I mentioned before, aren't just in hospitals, you see them in nursing homes too. So I think the last report I saw, there were over 30,000 adults that died in falls in nursing homes in the United States in the last year. So what do you think about patient experience, and what are you hearing about issues in patient experience?
Yeah, so I think this is another big challenge, especially when you talk about the quality of interaction and how it is delivered today. There's a lot of things about care. Care is one of the main component in healthcare. It's part of the name, and at certain points it's being diminished. When you talk about remote connectivity or phone connectivity, or even the time that's being allowed to be in front of the provider, providing a better human connection, face-to-face connection, as well as the ability to provide the better communication, so the patient throughout the entire flow and going through this different steps through onboarding, getting care, and following up, feels that he gets the care that he deserves. So I think that's one of the key issues. What technology barriers or issues or challenges you're seeing?
I think the number one, and we've talked about this before, I think the number one that we're seeing and we're hearing from customers is what I would say is technology fragmentation.
Yep.
So there are a number of point solutions for specific use cases. So that's a challenge. So they might have 5 different systems that are essentially doing collaboration, one for visitation, another one for let's say telesitting or that, and when you look at it at the core, it's collaboration, right? There's certain clinical workflow built around all of them, but it's different purchasing processes, different systems to learn for the nurses especially, but also for IT, different systems to support, and then there's a huge expense issue associated with that, but also think of the things you might not think of about what needs to be in a patient room and able to enable all these separate systems. You need Ethernet drop, you need power, you need all these things. And retrofitting hospital rooms is very difficult to do because it's expensive. If it's a busy hospital, the census is turning over all the time. So I would say technology issues are first and foremost on the fragmentation side.
Yeah. I would add the last item, at least, again, there's a lot of items. You can see there's a lot of this slide issues that we have collected, but what we're seeing more and more is really around the workforce. There is shortage of healthcare workers across the board, whether it's physicians, nurses, any type of providers, and this is not getting better. It's actually getting worse with the year and with the years, and one of the main issues that causes it is really the burnout. There's a lot of work. On one side you have you have the shortage of and the workforce and nurses and providers, and on the other side there is hiking usage. People need more. People are fortunately enough are living more today. More people need health. Unfortunately, the population is not getting healthier and they have more demand, so it causes a lot of burnout. A lot of people actually, a lot of providers and nurses actually leaving the field just because of burnout. So part of the challenges that we're seeing, and I think we hope we can actually solve. So so again, why are we here together on this? We've talked about all the challenges. How are we solving those challenges together?
Well, I think partnership is key to this because we have strengths in our value proposition kind of as additive with Zoom's because we have a broad portfolio of hardware and associated, I guess, support software products. But also a lot of video expertise, especially on the hardware side in healthcare environments. Like I mentioned before, we've been implementing video solutions for actual clinical delivery of care for a long time. R&D innovations we're doing both within kind of a healthcare focus, but more broadly, taken from the boardroom or the conference room and applied into healthcare settings. And then our ability to do things like managed services. Because if you want to deploy this at scale, like we think about it as kind of a fixed video, if you think of video services in every patient room rather than rolling something in on a cart for only specific rooms, you need to scale it among hundreds and thousands, and some hospital systems, tens of thousands in rooms.
Yeah. So I think on the Zoom side, there's a lot of good vibe here between the companies, because on the Zoom side, we provide, first of all, as you probably know, market share leading telehealth solution across hospitals, across outpatient scenarios. We lead with collaboration, AI-first collaboration software platform that many people already know and being used for healthcare purposes. We have significant investment in AI innovations. Our AI companion, our clinical node that we'll talk about in a few moments. And to close all of this together, we have a developer toolkit, APIs, and SDKs that allows partners to work with us and deliver those joint solutions.
So that's all great, but let's focus on how we can deliver things together.
Yeah, we're talking, a lot of, there's a lot of words here in this slide, but there's, I think by working together, I think the solution that we have identified that we can actually deliver together is really around the patient room of the future, and we can do it today. Even though it's in the future, as a sense of where we're thinking this is going to take us. Let me highlight a few items when it comes to the unified solution, and maybe I'll ask you to provide some of the examples around it. So I think the first item is really enhance the care quality. We've mentioned before, care is part of healthcare. We need to deliver better care to the patient. We need to boost patient engagement, provide them better access, better delivery, faster turnarounds, and to cap this off, we need to up-level the overall patient experience throughout the process. So we're talking about the care, we're talking delivering solution that will accommodate with the provider or the caregivers and the patient experience. So some items that you can actually, maybe you can give us a few examples here.
Well, this is really kind of a look at the use cases that we're seeing in the patient room. We're kind of showing this a little bit with disparate aspects of it, but we're tying this all together.
Yeah.
So there's the basic capability to be able to integrate with the patient engagement platform or IP or infotainment, you might say, system in the room to do basic things like virtual visits and family visits and that. But also being able to do virtual nursing and virtual rounding. Now, if you don't know what virtual rounding is, a specialist will go into a hospital if they have patients admitted into the hospital and they go see them in person right now. So if I'm a specialist, let's say I'm a cardiologist in the community, I may have admissions privileges at multiple hospitals around. I may only have one or two patients. So I physically go there, do my rounds, see one or two patients, and then inevitably a resident or somebody pulls you aside, and then you're there for an extended time, and then multiply that by multiple facilities, the time driving to and from those hospitals and back. But what we can do is now enable and their clinic, their specialty clinic gets backed up, right? So if you've ever been in a specialist clinic and the doctor's at the hospital right now, you've experienced that before. And other things like, instead of doing these complex device integrations, being able to use video to look at the monitors at the bedside, being able to do remote observations for patients that are at fall risk and that. So these are a few examples of kind of the use cases and the areas where we're trying to improve. But what I wanted to do is to show you this is not just futuristic or science fiction, it's being implemented today. And so we're showing a little video from an install we did at Blessing Hospital in Quincy, Illinois, 150-room Zoom and Poly collaboration where we're using our Studio X70 camera mounted in the ceiling with the Poly Studio X30 on top of the TV, integrated with the TV, automatically flips back. So starting with virtual nursing and specifically discharge, but that's already opened up an array of possibilities for them. They're starting to look at, can we get rid of our dedicated sitting system? Can we get rid of our dedicated specialty-specific telehealth carts? Can we do family visits? So, like I said, this is not the future. We're doing this together today.
Right. So,
and I guess following on from that, so a little bit of what we're doing today, but I want us to have a little time to talk about the future. So what's your perspective of what the future holds for the patient room?
So I think based on what... We can remove the... there you go. So based on the... we didn't expect that. Based on the fact that we have microphone and a camera in the room, we can extend our care to provide AI-enhanced solution that will provide better productivity, for the caregivers, the nurses. Zoom has recently announced Workplace for Clinician. This is our solution that utilizes generative AI, and we all know and agree that AI will transform healthcare. But now when you connect and interject both AI and generative AI and caregiving, we can actually enhance the experience of the provider. Providers today are spending about 20 to 30% of the time doing documentation. We can actually now have, through our telehealth, as well as mobile phone and doing face-to-face, a provider can actually enable the ambient listening, and our solution will actually take the notes, and less than a minute after the visit ends, basically provides the notes to the doctor, basically saving him probably 2-3 hours a day, at least from our studies. Now think about what such a solution can do in a patient room, in actual rounding, in discharge. So absolutely, really trying to solve the overhead that the healthcare team are dealing with. What else is HP doing on the future? Maybe you can share this with us.
Well, I think another area, in addition to AI, and we didn't even talk about machine vision and the opportunity for fall detection, fall prevention, all sorts of other things. But one of the things is we're really excited about is immersive collaboration, 3D collaboration. And we just launched HP Dimension, which you can see at our booth with Google Beam. But it's really about having more authentic human connections, and how we translate that into healthcare is the ability to convey care, right? There's a number of transmitting empathy, but also picking up on nonverbal cues and understanding better. Like, I think some of the research that we've done is that when people have that immersive collaboration, there's like 26% better retention of what somebody learned. But really what this is exciting is this just the starting point with what we can do with this now in terms of mental health and other kind of face-to-face clinical interactions. But really where we see the future is in basically the 3D healthcare environment. Like ultimately, if we can encode 3D from multicam, imagine what that does for medical education in the OR, or even the 3D patient room, which is where we see this coming out, is be able to see the whole context of the room and zoom in and zoom out of the areas of interest and get that whole field of view.
Yeah.
So thanks everybody for joining us today. But before we close, any takeaways you wanted to leave with our audience today? Yeah,
so we'll end where we started. So we mentioned Zoom is more than telehealth, and HP is more than PC and printers, right, Scott?
And if I was going to build on that, I think the other thing we caught at the end here is technology is rapidly evolving to deliver this patient room of the future experience with AI and 3D collaboration and even more things.
Yeah, and healthcare pain points are significant, but can be resolved. However, they require partnerships like we have an joint solution.
So I agree 100% with that. I might say that together we're making the patient room of the future a reality.
Yeah.
So thanks everybody for your time and attention and joining us today. Enjoy InfoComm. Stay safe.
Thank you very much.